कहाँ पे? गाइस आवाज आ रही है? कौन कौन लोग लाइव है जल्दी से बोल दो यार। शुभ शर्मा क्या हाल है? प्रिंस सिंह, शिवानी सागर, कुणाल, कहाँ से हो यार? जल्दी से बता दो कैसे हो आप लोग। क्लियर है वॉइस? कुणाल कॉमेडी मेनिया, भाई साहब जबरदस्त नाम है। कुणाल कॉमेडी मेनिया। उजैर, गुजरात, पटना, छिंदवाड़ा, कमलनाथ जी की जगह से वो छिंदवाड़ा, कोलकाता, नासिक, ठीक है, वेरी गुड। 256 लोग लाइव हैं। कैसी चल रही है भाई लोगों जिंदगी? गया, बोलपुर, ओके, कश्मीर, नागपुर, वेरी गुड, ठीक है। ऑल राइट गाइज, तो मुझे ये बताइए आप लोग का एक्सपेक्टेशन क्या है इस सेशन से? व्हाट इज योर एक्सपेक्टेशन? क्या पता करना चाहते हो? व्हाट डू यू वांट टू नो? यूरोप एमबीबीएस के बारे में पता करना है? बाहर जाने के बारे में पता करना है? आपका पहला चॉइस, योर फर्स्ट टारगेट इज ऑलवेज अ गवर्नमेंट कॉलेज, ठीक है। बट द थिंग इज we have 30,000 government college seats and we have 13.5 lakh students appearing for the exam, right? All of you know that. From Israel, and I wanted to give him this platform to discuss MBBS in Europe, right? ठीक है guys, so आप लोग शांति से इस सेशन को समझिए। एक चीज समझ लीजिए, इस सेशन में आपसे ये नहीं बोला जा रहा कि गवर्नमेंट कॉलेज की तैयारी मत करो, पैसे खर्च करो एंड गो टू यूरोप। दैट इज नॉट इज व्हाट इज बीइंग टोल्ड टू यू। आपको इंफॉर्मेशन दी जा रही है, ठीक है। इस इंफॉर्मेशन को आपको प्रोसेस करना और डिसाइड करना कि आपके लिए सही क्या है। इस समय पे व्हेन यू आर प्रिपेयरिंग फॉर नीट, दिस इज नॉट समथिंग विच यू शुड थिंक अबाउट टू मच, बट ये इंफॉर्मेशन आपके दिमाग में पीछे रहेगी, आपके जहन में रहेगी, तो आप सही डिसीजंस ले सकते हैं, ठीक है। तो मैं डॉक्टर कोहेन को बुला लेता हूं। सिंस ही इज नॉट एन इंडियन नहीं है, वो हिंदुस्तानी नहीं है, तो वो अंग्रेजी में बात करेंगे, समझने की कोशिश करिएगा। जो इजराइल से होते हैं उनकी इंग्लिश जो है वो सॉफ्ट होगी, ठीक है, तो आपको आराम से समझ आ जाएगी कंपेयर टू अमेरिकन इंग्लिश विच इज वेरी वेरी क्विक और ब्रिटिश इंग्लिश विच इज वेरी वेरी स्टिफ, ठीक है। तो इशू नहीं होगा, आराम से समझने की कोशिश करिएगा। कहीं पे भी मुझे लगेगा कि उन्होंने एक बहुत जबरदस्त चीज बोली और आपको समझ नहीं आई, तो मैं बीच में आके हिंदी में बोल दूंगा, ठीक है गाइस। तो स्टार्ट करें, बताओ स्टार्ट करें। शिवानी सागर, मैं हिंदी में डब करने के लिए बैठा हुआ हूं, चिंता मत करिए, ठीक है। तो स्टार्ट करते हैं, शांति से बैठ जाइएगा और नोट्स जरूर लीजिएगा। कुंदन मुझे रब करने के लिए चाहिए यहाँ पे, ठीक है। स्टार्ट करते हैं और मैं यहाँ पे डब करूंगा, मैं साइड में खड़ा रहूंगा और डॉक्टर कोहेन जो बोलेंगे आपको मजा आएगा। ही इज अ फैंटास्टिक पर्सन एंड यू वुड एंजॉय दिस सेशन। तो स्टार्ट कर लेते हैं। डॉक्टर कोहेन, मैं एक बार डॉक्टर कोहेन को माइक्रोफोन देता हूँ, फिर स्टार्ट करते हैं। जस्ट 1 मिनट गाइस, फिर स्टार्ट करते हैं। All right, guys. So we have Dr. Cohen with us. Dr. Cohen, these are your markers.
Thank you.
And a lot of students are watching you.
Hi everyone, I'm here today to tell you
Guys,
about...
सब लोग डॉक्टर कोहेन को हेलो बोल दीजिए, फिर हम स्टार्ट करते हैं। सब लोग जल्दी से डॉक्टर कोहेन को हेलो बोल दीजिए, then we'll start. All right, sir, let's go.
So hi everyone, I'm here to tell you about the option of medical studies in Europe. Within the next 30 minutes, I'll tell you about how do you get accepted to medical studies in Europe. And then I'll tell you about the possibilities, about the universities. Each university, I'll mention the budget to the university, the tuition fee and the common expenses. And then I'll tell you about advantages, disadvantages of medical studies in each university. So basically, in order to study medicine in Europe, you need two things. You need to graduate the 12th class, 12 years, and then you need to be able to pass an entrance exam. Entrance exam is a scientific exam in the fields biology, chemistry, physics, anatomy and physiology. Now, very briefly, everything that you're asked about in Europe has to be medically oriented. For example, biology, it means the structure and function of the cells in the human body. How does a muscle contract? How does a nerve transmit information? When we speak about chemistry, we speak about the molecular function of the human body. So how does the body function in the molecular level? When we speak about physics, we speak about general physics, classic physics, mechanics and electricity, and we speak about biophysics, which is diagnostic techniques, how they work, X-ray, ultrasound, MRI, etc. When we speak about anatomy and physiology, it's the organ, the heart, the lungs, the kidneys, the hormonal system, the immune system of the human body. So this is the frame, this is the scope of the material. Entrance exams in general are going to be held in India. It means that we invite professors from the universities. The professors will conduct a written exam, multiple choice exam. Following the written exam, you will have an oral interview, which is a motivation interview and an oral exam. And then after the written part and the oral part, usually within the same day, you'll know if you got accepted to a medical school. What we do, MD International Studies, is a company that I founded 12 years ago, 2006. Our company is international. It has branches in Sweden, Germany, New York, Israel, and now a new branch in India. And our aim is to prepare students for the entrance exams of European universities. So what we offer is a course, a scientific course in these subjects, medically oriented biology, chemistry, physics, anatomy, and physiology. The purpose of the course is that students will be able to pass the entrance exams and get accepted to universities in Europe. Courses, we have two options. We have an on-site course, it means in class, and we have an online course for those who are not able to come to our location, which is currently in Delhi. Now, when a student has graduated 12 years of elementary and high school, and then passed an entrance exam, the student is admitted to a medical school. Now, where to study medicine, we have several options. And what I usually do, I build a table. That's what I'm going to do now. I'm going to tell you about each country that we work with. In every country, I'm going to specify the universities. Then I'm going to speak about the budget of studies. The budgets I'm going to divide into tuition fee and into common expenses. Tuition fee is what you pay to the university. Common expenses is what you live from. It means rent, insurance, books, food. How much does it cost to live in a certain area, in a certain country? So this is the overall budget, and for my opinion, this is the most important consideration when you choose a university. and then I'm gonna briefly speak about advantages, disadvantages of every option. So let's start.
So guys, ये चीज आपको समझ में आ रही है ना सर? आपको डॉक्टर कोहेन जो भी आपको बताएंगे वो ये है कि हर एक जगह पे जब भी आपको कोई फॉरेन यूनिवर्सिटी चूज करनी है, खर्चे के दो पार्ट है। एक पार्ट है कि आपकी ट्यूशन फीस कितनी होगी, और दूसरा पार्ट है कि वहां पे लिविंग एक्सपेंस कितना होगा, रेंट कितना होगा, खाने का खर्चा कितना होगा, कुछ जगह पे आपको इंश्योरेंस लेना जरूरी है वो कितना होगा, वहां से आप इंडिया ट्रैवल करते हैं वापस जाते हैं वो सब खर्चा कितना होगा। तो सर एक टेबल के ऊपर ये सारी चीज समझाएंगे, ठीक है? तो आपका जो बहुत सारे लोगों का सवाल आ रहा है कि यूरोप में खर्चा कितना होता है, तो डॉक्टर कोहेन अभी उससे कवर कर रहे हैं। इस टेबल को जरा समझ लीजिए। यूनिवर्सिटी क्या है, बजट क्या है, एडवांटेज डिसएडवांटेज क्या है, इस टेबल से आप सारी चीजों को समझ सकते हैं, ठीक है? निखिल, ट्यूशन का मतलब ये नहीं होता कि वहां पे आप ट्यूशन लेंगे, जैसे हम नीट का ट्यूशन लेते हैं। ट्यूशन का मतलब है जो आपकी स्कूल में फीस लगती है उसको भी ट्यूशन फीस बोला जाता है, ठीक है? तो ट्यूशन का मतलब ये नहीं है कि आपको ट्यूशन लेना पड़ेगा। ट्यूशन का मतलब है आप किसी यूनिवर्सिटी में जा रहे हैं तो वहां पे जो आपकी फीस लगेगी जैसे आपकी स्कूल में लगती है उसको भी ट्यूशन फीस ही बोला जाता है, ठीक है?
Okay, so what we're going to do now is speak about the universities that we offer in Europe. And I will start with the first country, which is Croatia. And in Croatia, we work with the Medical University of Zagreb. Zagreb is the capital city of Croatia. They offer programs in general medicine, dentistry, and veterinary medicine. The tuition fee for Zagreb University is 9,000 euros.
And euro is 80 rupees.
Yeah. And the common expenses, it means how much it costs to live there. On average, it's around 600 euros per month, and it means 6,000 euros per year. So overall, the budget that you're expecting is around 15,000 euros per year, including everything. Now, several points about Zagreb University. Zagreb University is one of the best universities that we work with. It's known for its high quality. They accept up to 50 students per year for their international program. And it means that they teach in very small classes. They maintain quality, and that's the most important advantage. It's an opportunity to study in a capital city. Zagreb is the capital city of Croatia, in a relatively comfortable budget and a very high quality. So the quality of the university is very high. Entrance exam is going to be held here in India, and it's about everything that we spoke about. So physics, chemistry, biology, anatomy, and physiology. Now, I will take this opportunity before moving on with the universities to briefly explain about the scope of medical studies. Medical studies last 6 years in Europe. The first 2 years are called preclinical. That's where you study the basics of medicine. And then the remaining 4 years are clinical. That's where you enter hospitals and meet patients. The first 2 years, the preclinical years, are considered to be the hardest. And there is a certain dropout. It means that not all students are able to graduate after 6 years of studies. And when I'm asked about the most important advantages of our course, is first that we help students get into a medical school, and second is that the dropout rate of our students is very low. So most of our students are successful in the universities. Next, I'm going to speak about the Czech Republic. In the Czech Republic, you're able to apply to 2 universities. The first is Charles University. And the second is Palatsky University. The main difference is that Charles University is located in the capital city, in Prague. Palatsky University is located in Olomouc. Olomouc is a small city between Prague and Vienna. Second important difference is the budget. The tuition fee of Charles University is around 14,000 euros. Common expenses per month around 800 euros, per year around 8,000 euros. So as you can see, the overall budget for Charles University is quite high. Palatsky University, located in the periphery of the Czech Republic, is a bit more comfortable when we speak about budget. The tuition fee is 10,800 euros for general medicine. Common expenses around 6,000 euros per year. And it means that the overall budget is a bit more comfortable compared to Prague. Now, the universities in the Czech Republic are known to be of very high quality, and that's a very important advantage. Charles University, for example, is fully accredited in the United States. Of course, both of them are accredited in Europe. And in general, you should know that if you decide to study in Europe, in one of the universities that we offer, or in general in Europe, you should know that the most important gain, the most important benefit is that you open the world as a career opportunity. You can later on decide to continue to work in Europe because you are licensed when you graduate in those universities. And second, you can decide to persuade an American career. If you decide to do that, then you need to do the USMLE. USMLE is the United States Medical License Exam, and in general, you should know that if you consider Charles University, it's known for its high quality and the high passing rate of the USMLE. And it means that if you choose those universities, you are very likely to be able to work in the United States afterwards. Now, the universities that we work with, in general, allow also student exchange during their studies and allow students to do some of the clinical rotations outside the country. For example, you can choose to do it in the US. You can choose to do it elsewhere in Europe. You can choose to do it in India, of course, within acceptable limitations. But there is a possibility to do some of the clinical rotation, so some of the clinical experiences that you are obliged to do during medical studies, you can do them outside the country, and therefore to be exposed to other countries and to other career opportunities. We continue.
I just want to translate a few things. Guys, तो जो आप सुन रहे हैं, जैसे अभी डॉक्टर कोहेन ने चेक रिपब्लिक में दो यूनिवर्सिटीज के बारे में बताया, चार्ल्स यूनिवर्सिटी और पलात्स्की यूनिवर्सिटी, राइट? और सर ने कहा कि यूएसएमएलई में आपका एडमिशन हो सकता है. डॉक्टर कोहेन, व्हाट इज द फुल फॉर्म ऑफ यूएसएमएलई?
USMLE is the United States Medical License Exam. It is divided into two parts, Step 1 and Step 2. Step 2 is divided into clinical knowledge and clinical skills.
Okay.
But what is interesting for the student is Step 1 and Step 2 clinical knowledge.
Okay.
Step 2 is the preclinical part. It means that they are examined about the basics of medicine.
Okay.
Anatomy, physiology, biochemistry, pathology, microbiology, pharmacology.
Okay.
And Step 2 is the clinical part. They are asked about internal medicine, surgery, pediatrics, gynecology, and psychiatry.
Okay.
Once they pass these two steps successfully, they're able to continue with their career in the United States.
And what that also means, guys, एक चीज समझ लीजिए. If I'm correct, if you clear USMLE, you can do residentship there and you get paid very well for a year, almost $60,000 a year, right? You don't have to pay out of your pocket. The hospital is actually going to pay you, right?
When you work there, yes. So after you do the USMLE, if you are allowed to work in the United States, yes, you work for a salary, of course.
Okay, all right. Very good. तो guys, मोटी-मोटी चीज जो सर ने बोली वो ये है कि when you go to Charles University, USMLE में पासिंग रेट्स बहुत अच्छे हैं. इसका मतलब है आपका USMLE में हो जाएगा और आप US में जाके डॉक्टर रेजिडेंट बन के डॉक्टर बन सकते हैं, राइट? बट यहां से आप डायरेक्टली यदि USMLE करते हैं तो USMLE का इंडिया से सिलेक्शन रेट इज ओनली 19 to 20%, right? So that is the difference. So one important thing about Charles University is the selection rates in USMLE are very good. USMLE India के NEET PG की तरह. It is like NEET PG in India. Students will finish their MBBS. After that, they'll give a postgraduate exam to start doing specialization in whatever field that they are selected. USMLE is going to be similar to NEET PG in India?
Yes, it's similar to the board exam of India. Yes.
Okay.
Okay, let's continue with the countries. Another option that you are able to apply to is Italy. In Italy, there are basically two types of universities, private and public. Private universities, for example, Humanitas University. Humanitas University is located in Milan. That's the private. Public universities, you have many. You can find public universities in Rome, in Milan, in Pavia, in Bologna, in Naples. So there are many public universities. The main difference between the private and the public naturally is the tuition fee. Tuition fee for the private university is 20,000 euros per year. And common expenses in Italy are not cheap. It's around 8,000 euros per year. So that will be the total sum per year when we speak about private universities in Italy. When we speak about public university, the tuition fee is on average 2,000 euros, can be a bit less, can be a bit more. Common expenses, there is no difference between private and public, of course, because that's what you live from, and that's the average cost, which is much more comfortable. Now, the entrance exam to Italy is called IMAT, the Italian Medical Admission Test. For the private universities, you are able to do the IMAT within our facility. For the public university, you do it in designated sites. For example, they do it in embassies. For the private university, it's possible to do the entrance exam several times a year. So we have several occasions of entrance exams every year. For the public university, within the last years, it was only on September. Academic year starts on October. Now, several points to know about Italy. The level of education is good. It's a Western country. The environment is very impressive and it's very important for a lot of students. You should know that one very important point academically is that dissections are not allowed in Italy. And for example, when you study anatomy, when you study pathology, you study mainly from books. You are not allowed to do dissections as you are allowed in other universities. And that's something to consider.
You want me to quickly translate this point? Guys, एक चीज जो यहाँ पे आ रही है, आप एक चीज समझिए, इटली जो है, it was in the Western bloc, right? और बाकी जो कंट्रीज है वो ईस्टर्न ब्लॉक में थे. हम उस जमाने की बात करें जब सोवियत यूनियन और अमेरिका लड़ रहे होते थे, राइट? तो जो चेक रिपब्लिक, जो आप लिथुएनिया, यू विल हियर अबाउट पोलैंड, यहाँ पे सारी यूनिवर्सिटीज पब्लिक यूनिवर्सिटीज है। पर इटली के अंदर प्राइवेट यूनिवर्सिटीज है और पब्लिक यूनिवर्सिटीज है। प्राइवेट यूनिवर्सिटीज में ट्यूशन फीस है 20,000 यूरो, लिविंग एक्सपेंसेस 8,000 यूरो, 28,000 यूरो आ गया अप्रोक्सीमेटली। ये आपका साल का 23 से 24 लाख रुपए हो गया, ठीक है? पर जब ये पब्लिक यूनिवर्सिटी की बात आती है तो ये 20,000 यूरो की जगह 2,000 यूरो है, टोटल 10,000 यूरो हो गया। 10,000 यूरो का मतलब 8 लाख रुपए हो गया। तो पब्लिक और प्राइवेट में फर्क है। वन थिंग विच डॉक्टर कोहेन डिड नॉट से इज, मैंने इनको कल सुना था, ये वाले जो एग्जाम है एम्बेसी में होते हैं यहाँ पे। इट इज गोइंग टू हैपन इन इटालियन एम्बेसीज इन इंडिया, ये और कहीं पे नहीं होता है। These exams do not happen in embassy necessarily, right?
Right. These exams can be done within our facilities.
Okay, but these are going to happen in embassies.
In designated areas.
In designated areas.
Yes.
One more important thing जो डॉक्टर कोहेन ने कही वो ये है, और ध्यान से सुन लीजिए, जबरदस्त है, मुझे भी कल पता चला। I also got to know about it only yesterday. इटली एक कैथलिक कंट्री है। कैथलिक कंट्री के अंदर, tell me this thing, is it really true that Catholics do not allow dissection of the body?
I don't know if it's true in general, but in Italy it is true.
Okay. So इटली के अंदर बहुत रूल है कि आप मेडिसिन के अंदर बॉडी का डाइसेक्शन नहीं कर सकते। इसका मतलब जो भी आपकी बहुत सारी नॉलेज आप अक्वायर करेंगे इटली के अंदर, वो किताबी नॉलेज होगी। इट वुड बी बुक बेस्ड नॉलेज। प्रैक्टिस के टाइम पे यू कांट डू डाइसेक्शन, आप बॉडी को खोल नहीं सकते। So what happens in clinical years? They have to go out and practice that thing? They can't practice it in Italy?
No, in clinical years it's possible, because in clinical years when you go to a surgical ward, for example, so they teach you to do things, but this is live, people. So the thing is that
you can't do on cadavers.
When you study, no, exactly. When you study anatomy, for example, so you study from books, you study from, they have, especially the private schools, they have impressive 3D simulators. So it's possible to learn anatomy, but they don't learn it from dissection of cadavers.
Okay.
Now, I'm not necessarily saying that it's an advantage of this or disadvantage, but it's important for the students to know.
Okay. तो गाइस, आप इटली के अंदर डाइसेक्शन नहीं कर सकते हैं। एनाटॉमी के अंदर आप एक मुर्दा बॉडी के ऊपर काम नहीं करेंगे, आपको सिमुलेशंस मिलेंगे जिनके ऊपर आप काम करेंगे। ये एक चीज है जो, और गाइस मैं आपको यही चीज बताना चाहता हूँ। यदि आपको ये लग रहा है कि हम लोग इस प्लेटफॉर्म से यूरोप एडमिशंस को प्रमोट कर रहे हैं, that is not the purpose of this session. The purpose of this session is you should know what it means for doing MBBS in Europe. You should know what it means doing MBBS in US or Bangladesh or Nepal or Philippines or Georgia or Ukraine. So in Europe, you got to know a beautiful thing about Italy. Italy में आप अपनी MBBS studies में dissection नहीं कर सकते, ठीक है? Because it is a Catholic country. What, sir?
Okay, we continue. The next university or the next country I want to speak about is Lithuania. And in Lithuania, we work with two universities. We work with Kaunas University, also called Kobna University, and we work with Vilnius. Vilnius is the capital city of Lithuania. Now, let's start with the budget. The tuition fee for general medicine in Kaunas University is 11,500 euros. Common expenses on average are 6,000 euros per year. And here you have the overall budget in euros of Lithuanian universities. These universities are known for their good environment and their good attitude towards the students. So they tend to teach in relatively small groups, and I can tell you that having thousands of students so far scattered in many universities, the students in Lithuania universities are generally satisfied. In Lithuania, they teach in what we call PBL. PBL, it means problem-based learning. And it means that starting from the first year of medical studies, students are encountered with clinical situations. So they have very nice discussion groups, and they can say, okay, there is an old lady entering a room, that's how she feels, that's her blood test, that's her x-ray, what do you think she has? And then there is a discussion about it. And imagine it starts from the first year. So it's a very interesting approach, and from my opinion, a very positive approach. And that it's not only Lithuanian universities who do that, but Kaunas University is doing it, and the level of the university is accordingly high. And that's another option. The next country that I want to speak about is Cyprus. Cyprus, for those who don't know, also belong to the European Union, even though it is found in the Mediterranean. So the weather is nicer than Europe, it's warm, the atmosphere is good, people are nice, food is good, and that's very important for many students. The university is called European Medical University of Nicosia. European Medical University of Nicosia. Nicosia is the capital city of Cyprus. This university is a private university. It was established at first by an American university, and it means that it's very invested. So you can see that the equipment is very advanced. And they have amazing simulators, robots that can imitate diseases. And the students can learn clinical approaches using these robots. They also use other advanced methods like Actress that they have teaching clinical approach. This university is run like a campus, by the way, similarly to Humanitas. It means that you have the university and the dormitories and the gym and everything, and the cafeteria, everything within the same area. The tuition fee is quite high. It's very similar to Humanitas University. It's 18,000 euros. Common expenses will rise up to 6,000 euros per year. And here you have the overall sum of 24,000 euros. The level of the university is high, and the university in general accepts not more than 110 students for general medicine, and the dropout, the students who do not graduate after 6 years, is very low. They say that they pick their students well, and in general, they don't tend to fail students, which I think is another advantage. So I would say that these are the main options. Of course, there are others in Europe to which you can apply. With some universities, we work directly. With others, we don't, but there are representatives in India, so you can do the entrance exams within India. And I think that the bottom line of this session is that medical studies in Europe is a possibility to consider. So if you are not, for some reason, not accepted to medical school in India, because we all know that it's very difficult, I strongly advise that you will consider Europe. I did it myself. I come from Israel, and I didn't get accepted to med school in Israel, even though I tried several years. And I went to one of those international schools. I studied in Budapest, and I graduated 2006. It wasn't easy, but I graduated, and now I work in the cardiology field. So the bottom line is that it's possible. It's possible to do it, and I think that the main advantage of these international schools is that these schools are English-speaking. You get to study with people from all over the world: Sweden, Israel, Norway, India, China, US, Canada, and more. So you get to meet people from all over the world. You get exposure to many cultures and to many future friends that you're going to have all over the world. The quality of the education is in general very high, And I think that the most important thing is the career opportunities. Later on, you can, of course, return to India to do the board exam and work here, but you can also consider working in Europe, and you can also consider working in the US. The world is open once you choose one of these possibilities. Thank you.
Dr. Cohen, a few questions I have. One question students are asking is, how much money you can make by working in Europe? आप यूरोप में काम करके कितने पैसे कमा सकते हैं? Once you start practicing, what is the typical kind of money you can earn?
Okay, so in general, we divide doctors to two types of doctors. The first is the junior doctors, when you specialize. For example, you specialize in surgery or in internal medicine or in plastic surgery. When you specialize, you don't make so much money, and it is diverted from country to country. For example, in Germany, it can be 3,000 to 5,000 euros per month. In the US, it can be around $5,000 to $6,000 per month. In Sweden, it can be 5,000 to 7,000 euros per month. That's the average salaries of a junior physician. When you graduate, when you're a senior physician, then the sky is the limit. Some physicians do $10,000 per month. Some physicians do $1 million per year. So it depends what they do and where they work.
Yeah. Okay. Second question. Are there any scholarships in the universities that you're talking about?
So in general, when we say scholarship mainly exists in Italy. It means that after you're admitted to a university, you can apply to a scholarship. Receiving scholarship depends on your grades. Of course, you should be excellent in the admission test, and you should be excellent throughout the years in order to maintain the scholarship. Scholarship can be for the tuition fee, and sometimes it can also be for a part of your common expenses. In addition, some universities give you a kind of bonus. If you are an excellent student, you can have a reduction of about 10% of your tuition fee. But then you have to be excellent throughout the years. So for example, if you have 90% and over in all of your exams throughout the years, you can have about 10% reduction in your tuition fee in some universities. These are the options.
All right. Guys, any other questions? Dr. Cohen, just 1 minute. Let me check. Up to Harvard scholarship, Rakesh, आपके सवाल का जवाब मिल गया है. What else? Okay. Students want to know what is the process. How do they get admitted into the universities? What is the process? Is there any assistance you provide in helping students? Every university would have a different exam, right?
Yes, I will explain.
They would take their own exam.
I will explain. So when a student has graduated the secondary high school, the 12 years of basic studies, regardless of what you studied in high school, doesn't have to be science, you can apply to entrance exams. Now, as I mentioned before, what we offer is a prep course for the entrance exams. Now, regardless of whether you did a prep course or you want to just take the exam, you can apply to do the entrance exams within India. Entrance exams, it means that we invite or another representative invites professors from the universities. Professors will come here, they will do a written exam and then an oral exam, and then they will give you the results. It can be on the same day or several days after the entrance exam that you know if you got admitted. Now, if you join our course, we do the application with you to the entrance exam. So you do the course with us, you do the entrance exams in our facilities, and then you get the admission letter. Once you have the admission letter, you have to get a student visa. And that's a relatively easy process. You apply to the relevant embassy and you issue a visa. With this visa, you travel to study abroad. Now, it's important to know that entrance exams we have on several occasions throughout the year. For example, the next course that we will open in India will be in the 15th of October. Students who will join this course will do the entrance exam at the end of January. Then we have a course that will open in the beginning of April, and the students will do the exam on the end of June. Now, when a student passes the exam with the acceptance letter, the student can issue a visa. When you have a student visa, you just travel to the university. And here it's important for me to emphasize, medical studies starts on September, October of each academic year.
So what you're saying is that the entrance exam is going to happen in February and May.
It's going to be February and June, yes.
February and June. So guys, यदि आपको मैं नीचे नंबर डालूंगा, किसी को ये जो एंट्रेंस एग्जाम होगा इसके प्रेपरेशन के लिए आपको कोर्स करना है, तो उस नंबर पे आप कांटेक्ट कर सकते हैं. मैंने इससे रिलेटेड जो वीडियोस डाले हैं उनमें वो वाला नंबर था, बट मोटा मोटा ये है फरवरी और जून. तो जो लोग 12th में कर रहे हैं, जो अभी 12th में है और यूरोप के बारे में सोचना चाहते हैं, उनके लिए ऑप्शन फरवरी थोड़ा बेहतर है, क्योंकि ये जो कोर्स है. सो हाउ लॉन्ग इज दिस कोर्स, बाय द वे, दिस कोर्स दैट यू डू टू हेल्प स्टूडेंट्स प्रिपेयर फॉर दीज एंट्रेंस एग्जाम्स?
So if you do the on-site course, it's a 14 weeks course.
14 weeks,
yes.
Around 3.5 months.
Yes.
Okay.
And if you do the online course, it's open for 4 months.
Online course is open for 4 months.
Yes.
Okay. All right. So guys, regarding this course, information about this course, I will put information in the description of the video. The details which are available with the video, I will put all that information, so that if you want to get in touch to do this course for entrance into universities in Europe, you can get in touch with the right person. Any other question, guys? You have, guys, एक question आपका ये है, आपको नीट क्वालिफाई होना जरूरी है क्या? डू यू नीड टू बी नीट क्वालिफाइड टू गो टू यूरोपियन यूनिवर्सिटीज? एक चीज समझ लीजिए, the regulation that MCI came up with, that even if you want to go to India, you have to be qualified in NEET, that is only applicable if you want to come back to India and give FMGE exam. If you don't want to come back to India, you don't need to qualify NEET. If you need to practice outside India, you don't need to qualify NEET, right? तो ये चीज समझ लीजिए. MCI regulation happens because MCI wants people to have certain qualifications before they are going outside, if they are going to come back to India with foreign medical graduate examination FMGE. But if you are going to go to Czech Republic, Poland, Italy, wherever, and then you are going to go to US MLE and do your residentship and become a doctor there, then NEET qualification does not matter, right?
Yes.
Okay. Guys, और कुछ क्वेश्चन है तो पूछ लो. Any other question you have, मैं पूछ लेता हूँ यहाँ पे. I think that's pretty much it. So yeah, I think that is good.
Thank you very much, and thank you for inviting me.
Thank you so much. All right, guys. तो ये खत्म करते हैं, and we will get back to our NEET studies. यूरोप के बारे में आपको जानना है तो इस वीडियो के डिटेल्स में अभी 1 घंटे में सारे डिटेल्स अवेलेबल हो जाएंगे. ठीक है, चलिए गाइस. थैंक यू डॉक्टर कोहेन.
Thank you.
बोल दिया था सर आपने.